The long-term impact of Covid-19 on patients is still unclear, but specialists are concerned that for some it's causing strokes and other types of damage to the brain. Our medical correspondent Fergus Walsh went to meet one man who spent 5 weeks in hospital with coronavirus and had 2 strokes.
Paul Milray will never be able to go diving again, but he feels fortunate to be alive. Covid-19 first attacked his lungs and then caused 2 massive strokes. The 64-year-old has made an astonishing recovery, which doctors put down to his high level of fitness.
I have 4 weeks of my life that is absent. I don't remember it. When I came round, I couldn't really get out of bed and I couldn't read anything. So I'm lucky in physical terms. I've still got a bit of problem on the right-hand side, but it's minimal. I can read now, but it's tough. I forget what I've done. Yeah, I've done something and then suddenly I'll forget what that is.
So, Paul, welcome to your cognitive rehab session.
Paul is not alone. In just 2 weeks, doctors at the National Hospital for Neurology in London treated 6 COVID patients who suffered strokes, all triggered by unusually sticky blood.
This is the area that's been affected by the stroke. This is the acute stroke.
After his first stroke, Paul was put on blood thinners. But despite that, he suffered a second, even bigger stroke. To their surprise, doctors found clotting markers in the blood hundreds of times higher than normal.
It's not the likes of anything we've seen before in stroke. Certainly from a treatment perspective, certainly from a clotting factor perspective. I don't know if we exactly know, but something about this illness is causing a hyperclotability, causing clots in the legs, lungs and brain like we've seen here.
Neurologists are also seeing COVID patients with extensive inflammation of the brain, caused, they think, not by the virus, but by the body's immune system overreacting to the disease.
We're quite concerned that we're starting to see effects of COVID on the brain that we haven't seen before. For some people, this can be a devastating and life-altering illness. I think we need to be prepared for decades of impact on people's brains and mental health.
There's so much yet we don't know about how coronavirus attacks the body, but it's clear the brain is vulnerable. Paul's recovery is exceptional. Others are not so fortunate. Fergus Walsh, BBC News.
A new treatment for